Hello friends. Today we are going to discuss our medical discussion in English version because most of the some of the people are requesting us to make video in English version because they are unable to understand properly. So we will bring up in the English version from today. So let's begin. Hope so you will like it. So first question is, what are the causes of neck pain and or what is the cause of cervical spondylosis?
The cervical spondylosis, this is a very common diagnosis which most of the patients they present with neck pain in our OPDs. So in most of the cases, the cause of the neck pain is cervical spondylosis. There are some other causes, but today we will be discussing about cervical spondylosis. So before we know what is cervical spondylosis, so let us discuss about the anatomy of the vertebral column. So we all know that the vertebral column, it is made up of some number of bones, and in between the bones there are certain plates. These are some plate like structures which connect the different bones of the vertebral column. So when these bones, these are connected together by these plates, so we are able to bend forward, we are able to move our spinal cord. Had it been a single bone, we could not have bent forward, we could not have moved, our back would have been straight. So because there are certain plates in between these bones, so we can move easily, the spine could be easily moved. So now we all know that in behind that vertebral column there is a spinal canal. In this spinal canal is the spinal cord. The spinal cord, it begins from the base of the brain to the lower bottom. So the cervical spondylosis, the plate which is in between these vertebral bones, especially in the neck, because of excessive bending, this plates, it slips backward and it compresses the spinal cord as well as the nerve roots. So this is the main anatomy of the spinal cord and the main cause of the cervical spondylosis. Now regarding the various causes, how it occurs, the most important cause of cervical spondylosis is the continuous bending of the neck. Because of mainly the occupational causes, nowadays the people used to sit continuously in front of the computer, they continuously look into the mobile, and because of this there is continuous bending of the spinal cord, and with time the plate which is in between these bones, it slips backward and compresses the spinal column as well as the nerves which exits from the spinal column. So because of this compression, a person can have all the symptoms of the cervical spondylosis. There are certain other causes, mainly nutritional causes. A person whose diet is deficient in various vitamins, various minerals like calcium, the person can have cervical spondylosis. Also, with time, with age, there is dehydration of the cervical disc. Because of the dehydration, the disc shrinks and it continuously shifts backward, which is one of the cause of cervical spondylosis. Also, with age, there can be osteopenias, osteoporosis. That is because of lack of calcium, the bones, it becomes brittle, and because of that also, a person can have cervical spondylosis along with the lifestyle causes. So again, there is another important cause of cervical spondylosis is that when a person had some trauma or accident, there is some kind of injury in the cervical column, in the neck bones, it can also lead to fracture of those bones, and ultimately these bones or the bone particles, it can compress the spinal cord or the spinal nerve roots that lead to cervical spondylosis.
Thank you, sir, for your valuable information. So, we would like to know what are the signs and symptoms can be seen in the cervical spondylosis patient.
The cervical spondylosis, the signs and symptoms, it can range from mild to severe. In the mild cases, when a person can have, when the cervical spondylosis has just started, the person can have just mild pain in the back of the neck. This pain can radiate to the back of the head, or it can radiate to the back or even the hands. So with increasing of the intensity of this pain, the cervical spondylosis, the person can have more severe pain in the neck, that is that can be continuous, that can be radiating, or this pain can be severe in the hands or in the back of the head. Also, there can be paresthesias, like there can be abnormal sensations in the back, abnormal sensations in the hand. Moreover, if the compression increases, there can be weakness of both the hands. If the compression is still more severe, there can be weakness of both the lower limbs, that is both the legs. The person can have difficulty in controlling the urine, the person can have difficulty in controlling the stools, or there can be inability to hold, or there can be inability to pass stool or urine. So if these symptoms has started, then it is mandatory that a person visits the doctor, and can and these symptoms, if it occurs, the person may need surgery. So these symptoms, if it occurs, it usually indicates that there is severe compression of the spinal cord. So these symptoms, all the symptoms, it can be mild or it can be very, very severe.
Thank you, sir. So now I will ask, sir, one thing question, sir. What are the treatment can be given in the case of cervical spondylosis patient? And the surgery is mandatory or not, sir, for this kind of patients?
See, the treatment, it depends how severe is the symptoms. Normally, in mild cases, the person doesn't need any kind of surgery. In the mild cases, we generally divide the treatment in three parts. In the mild cases, only physiotherapy is enough. Whenever a person feels pain in the neck because of cervical spondylosis, he can go for physiotherapy. During physiotherapy, certain exercises are done, certain exercises are taught to the patient. With these exercises, the person can strengthen his neck muscles, and if these muscles are strengthened, there will be less there will be less compression of the cervical column, or there can be when the muscles are strengthened, the person, if he bends his neck also, there can be less slippage of that disc. Number two is that medication. If the person is still feeling the symptoms, or his symptoms are not relieved with physiotherapy, the person can go for certain medications. There are certain painkillers or non-steroidal anti-inflammatory medications that help to reduce the pain. Moreover, there are certain muscle relaxants that relaxes the muscles and decreases the intensity of the pain. Also, in cases of the pain because of the nerve compression, there are certain medicines like pregabalin, gabapentin, which decreases the intensity of these paresthesias or the pain. If still the patient feels symptoms, or if there is weakness of both the lower limbs, both the upper limbs, there is abnormal sensations, if the patient has difficulty holding the urine, then it indicates that there is severe compression of spinal cord, and this kind of patients may require surgery.
Thank you, sir. So I would like to ask one question. What are the preventive measures of like this kind of patients?
So normally we all know that cervical spondylosis is generally a lifestyle related disease. Because of continuous bending of the neck, because of the occupational hazards, a person usually exposes to this kind of hazards and ultimately lands up in cervical spondylosis. So normally we have to sense our lifestyle. It's better the person should not continuously bend his neck. A person can use cervical collars while using the computers or while doing their occupational jobs. So person, if he uses that cervical collar, the muscles usually gets relaxed, as well as there is less chance of slippage of the cervical disc. Moreover, proper nutrition is very important. The nutrition food rich in vitamins, rich in calcium. Person, if he takes alcohol or smokes, should immediately stop such kind of addiction. The person should go for regular exercise. He should go for physiotherapy to strengthen the neck muscles. And with these preventive measures, the chances of having cervical spondylosis, or the chances of progression of the cervical spondylosis, is usually greatly reduced.
Thank you, sir. Today you have explained nicely everything about cervical spondylosis, what is the cause, how to prevent. Thank you, sir. So, what will tell our audience for last?
So cervical spondylosis, this is a very common disorder. We usually encounter most of the patients coming with neck pain which are diagnosed with cervical spondylosis. So usually when a patient feels neck pain, or if the pain increases in intensity, along with there is paresthesias of the legs or the hands, then a person should immediately visit the doctor. He should go for some diagnostic investigations like MRI, CT scan, X-rays. Then if it is diagnosed with cervical spondylosis, then the person should go for lifestyle changes, may need to take medications, and before it becomes severe, he should immediately change his lifestyle, go for physiotherapies, and he should immediately stop alcohol, stop smoking, go for healthy nutritional diet. So I hope that this videos has cleared most of the doubts about the cervical spondylosis. I hope you will all like, share, and subscribe this channel. Thank you all.
Thank you.